This is a film about the operation you're about to undergo, which is either a tension-free vaginal tape, or TVT, or a tension-free obturator tape, or TOT. This is a short film which tells you why you're having the operation, the sort of anesthetic you will have, the risks and possible complications that you may suffer, and what to expect afterwards. So why might you be having a TVT operation? The commonest reason for having this is because of stress urinary incontinence. This is a condition which affects many women and results in the loss of urine when coughing or sneezing or straining. The other sort of urinary leakage is due to an overactive bladder, which means that you often have to get to the loo urgently and frequently. The third type of leakage is a combination of the stress incontinence and the overactive bladder. The TVT is designed to take care of the stress incontinence. The reason why women leak when they cough or strain is because there's often a weakness at the neck of the bladder, which means that urine can leak out when the bladder is put upon pressure. There are a number of ways you can treat urinary incontinence. The first is physiotherapy, and this involves pelvic floor exercises. Often a physiotherapist or specialist incontinence nurse will teach you how to strengthen the muscles of the pelvic floor, and about 70% of women have a significant improvement in their stress incontinence. The second form of treatment is by taking drugs to strengthen the neck of the bladder, and if these non-interventional treatments fail, an operation such as TVT may be indicated. The tension-free vaginal tape operation usually takes place in an operating theatre and can either be performed under a general anaesthetic or under local anaesthetic or sedation. The idea of the operation is to put a tape, which is really a strip of mesh, underneath the neck of the bladder as shown in this diagram. In order to do this, a patient is placed in the lithotomy position and an incision made just within the vagina and the tape fed through so that it forms a type of hammock either side of the neck of the bladder. In order to do this, 2 small incisions are also made at the lowest end of your tummy either side of the midline. No surgery is without risk. The risk of the TVT operation includes having an infection, suffering from bleeding during the operation, or having injury to surrounding structures, particularly the bladder, for instance. After the operation, a common complication, which usually resolves itself, is problems with emptying the bladder or voiding problems. Sometimes this problem takes just a few hours to settle, on other occasions a few days. During this time, a catheter may need to be used. Sometimes the problem takes a little longer and the use of a catheter intermittently is required. Rarely, the tape can protrude a little into the vagina. This is called tape erosion. Fortunately, this rare complication is usually quite straightforward to correct. The other operation for stress incontinence is the transobturator tape. The difference between a TOT operation and a TVT is that instead of the tape exiting through the lower end of your tummy, the tape comes out in the crease of the groin either side, as shown in this diagram. The results for this form of surgery are similar to that of the TVT. Some surgeons prefer to perform this operation. Others reserve this operation for when a patient has had many operations in the abdomen and there is perhaps a greater risk of bladder injury using a TVT operation. After the operation, you will return to the recovery ward and it will be particularly important to ensure that you are emptying your bladder properly. The nurse will measure the quantity of urine you produce and use a special ultrasound to see if there is any remaining urine in your bladder. If this is a significant amount, you will be encouraged to empty the bladder properly. Sometimes this takes several goes. Once the nurse is satisfied that there is no significant amount of urine left in the bladder, then you are able to go home the same day. By the following day, you will usually feel well in yourself. However, it is important to have only moderate activity for about 4 to 6 weeks. This ensures that the tape becomes fixed in the correct position and is not stretched in any way. By not straining the tape in these first few weeks, it's hoped that the success you enjoy from the operation can be enjoyed in the long term. About 6 weeks after your operation, you'll be invited back to the outpatients. You'll be asked how your bladder is working and whether there are any problems. You will usually be examined to check that the wound sites have healed and whether there is any evidence of tape erosion. We hope you found this film useful. If you require any further information, please do not hesitate to contact either your GP or gynecologist. There are also a number of helpful patient leaflets on the TVT or TOT operations. Thank you for listening to this video. We value your feedback and thank you for taking part in the PIVOT study.